I I see that some of you I'd like to just sit and have a long conversation, but I won't do that right now. Okay, uh, just to remind you that the Center for Health and Hope has its purpose to support and advocate for persons living with HIV and AIDS throughout the world, programs of education, prevention, care, and treatment. Uh, we keep hoping that, there might be a day when we could change that mission statement that HIV and AIDS would disappear, but over 40 million people are living with HIV in the world today, and many more are being infected. The current situation with the dramatic cutbacks in the United States contributions to PEPFAR and USAID, that it's likely that we're going to have more infections. We were at a crossroads. Some of us went to the International AIDS Conference last year, and they felt we were at a crossroads in which we needed more funding, and we would get over the hump, and we would find that cure, vaccine, prevention, many steps. Well, we've come to the crossroads, and instead of crossing over, we've gone backwards in the United States. So we don't know what the future will hold. The Center for Health and Hope, however, does not receive any funding from the federal government. We are dependent on our donors and our friends like you. And so our work continues and really needs to expand under the new leadership that Justin Levy is providing as executive director. I'm thrilled about our transition in the last 6+ months and our continued moving forward with new programs and new ideas and services. Things things couldn't be better for the center, but they couldn't be much worse for the people we seek to serve in the world. So that combination means that we need even greater volunteers and more work from each of us if we're to work with our partners who are stranded in other parts of the world as well as in the United States. So my colleagues today are going to share what we're doing, and we want to hear what you think we should be doing and what other ideas that you might want to share. Justin has a financial report, and anytime you want financial reports, we try to be as transparent and accountable with the funds as possible. And you, as a donor, are certainly worthy to hear that. We're very open to share. Justin?
Great. Thank you, Don. So wonderful to have you all here with us today. And I do have a quick financial report. Um, for some reason, it's not allowing me to switch the screen, so I will figure that out here. Here we go. All right. My apologies. Um, okay, everyone can see the pie charts.
Mhm.
Wonderful. So, just to give you a quick snapshot of the center's impact, your impact as donors, last year we brought in roughly $320,000. And as you can see, the vast majority of those dollars are from individual donors, 93%. Out of the 320,000 brought in, we had expenses of over $299,000, with 82% of those dollars being allocated to the programs in Kenya, Rwanda, elsewhere. And that distribution of grants can be found on that final pie chart. And you can see Kenya received 64% of those dollars. India is a distant second at 24%, and then our support in the US and other locations follows. That is a quick snapshot again of 2024. As time progresses, those numbers, distribution of grants to various countries will, of course, vary, but the heart and soul of the beginning of the center really can be um, uh, definitely is focused on the countries of Kenya, India, and in more recent years, Rwanda, in addition to, of course, work here in the US. So To kind of walk us through what we're currently doing in Kenya. Bonnie Messer is going to take us through some of our current programs and initiatives. So, Bonnie, if you'll take it away, that'd be great.
Okay, thank you, Justin. It's really great to see all of you today and have a chance to chat with you a bit about what we are doing in Kenya. And as you saw on the chart from Justin, significant portion of our gifts are going to programs in Kenya. So thank you to all of you who are part of providing those funds. And I see you here and know some of what you're doing. We have a variety of programs. Well, and let me say just a couple other things about my connection. I'm one of the original six. That's when we started the center. There were six of us on the board, and I'm one of those. And when I was in college, one of my good friends, Sarah Wanina, was from Kenya. And so she has helped me see many of the things that were uh, going on and what was needed there. And we've had wonderful times working with her and others. If you look at that Kenya map, where we do the majority of our work is sort of up above where it says Kenya, where the black letters Kenya are. We're up there at Meru and Mawa are the two major communities that we're working from. And we started with our concern for AIDS orphans. Parents were getting HIV, AIDS, and there was no medicine, no nothing to help with these children. Parents had moved to the city with their children, got HIV, died, and then suddenly grandmothers, aunts, and uncles were needing to take care of these children, and they were coming back up to Meru and other places. And how are these grandmas supposed to handle it? While school is free in Kenya, you still have to pay for uniforms, you have to pay for school fees, food often for the children. So how is that going to be handled? And the center has committed $200 per child for 315 orphans. And the orphans are identified by local persons in the communities. We have health workers in each community that say, "Oh, these are children needing help." And so we have at this point, well, we started with much less, and then we had 200, and then another church quit what it was doing, and we ended up with 315 children that we are supporting on a yearly basis. One of those orphans that we supported, and we've been doing this now for over 20 years, one of them graduated. Her name's Glory Gatonga, and she is our present social worker. And she helps us to understand what the needs of the children are, how we can be helpful. She's on the ground every day, checking out what needs to be done. So it's wonderful having her there. I wish you could all meet her. She's just a delight. We've tried to get her to the United States, but so far haven't been able to get her a visa to come. And I think you would be interested to know that just recently she received the Best Human Rights Activist in Meru. She was given this special award. So very proud of her and the work that she does. We 15 or excuse me, 13 of us will be going to Kenya in about 2 weeks, and we will be with Glory and visiting the orphans, visiting the community health workers, looking forward to understand what their needs are at this point. And my understanding is that just our coming and saying that we are there and we appreciate what they're doing is a very important piece for them to have that recognition. So we're glad to have the opportunity to go. One of the other persons we work with is Dr. Catherine Matua, and she has been on the ground since the beginning, helping us with a variety of programs. And you now see some pictures. One of the things that, one of the latest things she's been doing is helping us to identify persons who could benefit from a grandmother's house. And this is one of the houses that is um, built by local workers. And I love the colors of the houses, but it's on a very firm foundation. If you saw some of the houses that these families lived in before they got a house, they're really shacks. They're really not safe. There's no doors, windows, etc. And so you can see that these there are 3 rooms and a water tank. We provide the families with mattresses and bedding, and it's just a very wonderful thing to be able to do for their families. And when we are there in 2-3 weeks, why, we will have an opportunity to dedicate at least one and probably more of those houses. So very pleased to see those coming along. We all have been in the past working with MAWA Hospital they have been identifying families with needs and have been building the houses near to MAWA. And now we're doing it in 2 places. So I think in total we've provided over 30 of these houses, and uh, people have donated $3,000, and that's enough to create one of these houses. So it's amazing what you can do to help persons with these. So they've been dedicated to families and loved ones over the years, and we're just pleased that we can be an ongoing part of that process. Um, so in addition to Catherine working with the houses, she also is the head of the Methodist Treatment Center. And it is a program for persons struggling with alcoholism and other addictions. And it's been an inpatient program, and they're now expanding to an outpatient program. They have buildings available, but they need to be remodeled so that they can be able to provide the outpatient programs. And so the center is in the process of providing funds to help them do this upgrading of the buildings so that they can meet the needs of the people, and hopefully we'll get some more funding from the state or from the country as we improve the facilities and they're able to offer more services. Let's see. The other thing that Catherine has been very involved with is medical camps. The center is providing funds to do 4 medical camps a year. And again, one of those will happen while we are there this summer. And people come from miles, walk to come to these medical camps. They get tested for HIV, they get other medications. It's an important program for them. One of them I was at, they were providing dental care, and my translation of that is they were pulling teeth in the other room. But it was a necessary thing, and people were very grateful for the care that they were getting. And again, we do 4 of those a year. Let's see, other programs. I told you we were working with these 315 orphans, and they keep growing, and they graduate from high school. And here are some pictures of some of our post-secondary scholars. We now have over 40 students who have come through our programs and are presently in school. We had 12 that graduated this year from their programs. So they are now out in the community providing services. And in their letters to us, they talk about how they are excited about the opportunity to get to help the communities that have been helpful to them over the years. So the young woman on the right, she is just graduated, and they're celebrating her. And the young man on the left, one of the things we learned is that when they're in college, they could really benefit from having an iPad. We found that many of them were writing their papers on their cell phones. I can't imagine how you would write a term paper on your cell phone. So we have been providing laptops to these young people. And again, it has been because of all of you that have reached out and said, yes, I'll provide a laptop for a young person, that they have been able to utilize them and move forward with their programs. And the special committee for post-secondary scholars recently met, and Brad is a part of that. And we have got 8 new scholars that will be starting this fall into their program. So some of them are in education, one is law. We've got 2 that are in midwife programs, and very excited to watch the good progress that they're making. But we're very excited about that program, and it couldn't happen without Brad keeping up all the records. There's an immense number of records that have to be kept with these students, and Brad has been doing that. Finally, well, one of our newest programs is the Love, Peace, Care Ambassadors, and they help to support local LGBT persons. And we are just very, very pleased that Glory again has taken a major role in reaching out to the LGBTQ community, which often doesn't get very good care. It's not against the law in Kenya, but they're not well treated. So this is a good place for them to come and be safe. And we're very, very pleased to have them be a part of our programs. We also are doing some work with young women who cannot afford to buy sanitary supplies, and so we are programming to send money to them, and we have sanitary napkins being made so that they're reusable, and that is one of the other programs. So lots of things going on in Kenya, and there may be other ideas and things you would like to see us be involved with. And if you've got questions about any of these, I'd be glad to try to answer some of that. So with that brief going over those many programs, I'd like to turn it over. There's our picture. You can see the young woman in the middle sewing the sanitary pads, and you're seeing there also food that is being supplied to the persons involved with the LGBTQ program. Just so many different ways that we are reaching out. So again, thank you for what you're doing. And Chin has a report for us on all the different things that the center is doing in Rwanda. Chin?
Thanks very much, Bonnie. It's so good to be here and to have so many of you join in this call. Uh, I'll be delighted to share with you a few words on our mission in Rwanda. Just a quick introduction. I've been a volunteer with the center for close to 10 years now. It's just been a great joy to be of service, to be able to make use of my passions in technology and music. But also my partner Brad and I, we love to travel. And so it's been a great delight to be able to travel with Bonnie and Don to India, to Kenya, and also to Rwanda. Now, I have barely slept the last couple of days, um, and I'm compelled to reflect on these political times, these politically charged times that we live in. And I can't help but think of lessons that we can draw from the history of Rwanda, a country that is barely a generation ago saw one of the most rapid and brutal genocides in human history. what misinformation and disinformation can do to tear apart a country and to turn neighbor against neighbor. I can't also help but think of how preconceptions and prejudices are reinforced in an age of conspiracy theories, amplified in ecosystems without checks and boundaries, of how lies are played over and over to people who aren't open to the truth anymore, but are open only to narratives that are fed to those who agree with them. And if they are not with you, they must be against you, and they've got to be evil and inhuman. We see in Washington today politicians turning upon each other and how the basic bonds of trusts have been broken up and down, left and right. And with what has happened in Minnesota over this weekend, with the recent terror that's been rained down on illegal immigrants all over this country, and the horrors of what happened 30 years ago in Rwanda cannot be forgotten or watered down. We must take heed and not go down that same path. To its credit, Rwanda has made notable strides in minority rights by promoting national unity and removing ethnic labels from ID cards and empowering women. Women, get this, now hold over 60% of parliamentary seats in Rwanda, reflecting strong gender equality efforts. So I would say that overall, Rwanda shows progress, though challenges persist in the full inclusion of all minorities. Take, for example, the indigenous Twa, the Pygmy people of Rwanda. Brad and I had the privilege of meeting such a community during our visit in 2019. They were overjoyed to show us their brand new water tank, where before they had to walk for miles to the nearest pipe. They remain terribly marginalized even though they are constitutionally recognized in name. And while LGBTQ Rwandans have protections against discrimination, legal recognition of relationships is lacking, and stigmatization continues among family, church, and society. Over the years, we have received reports that the RPF, under longtime President Kagame, is facing criticism for its treatment of religious organizations and individuals, with allegations of restrictions on religious freedom and the suppression of dissenting voices. Sounds familiar? The center has in the past supported clergy families in the Rwandan Methodist Church with income-generating projects such as pigs and goats or vegetable gardens. We have also organized workshops on AIDS education and prevention in an effort to counter the deeply entrenched beliefs in superstition and witchcraft, which sadly is still central to many African conceptions of disease causation and etiology. More recently, we have expanded our outreach through a young and dynamic partner in Reverend Augustin Bahati from rural Gisenyi. Bahati has modeled himself as the Rwandan Don Messer in championing social justice and minority inclusion. With our support, he has successfully procured health insurance for over 120 families and nutritional support for 300 students. He has also successfully administered projects benefiting the poorest of the poor. Let me mention just a couple. One is a hair salon owned and operated by young LGBTQ women and men who have been ostracized by families and kicked out of schools. Another is a program training women who come from rural counties in sewing skills, and they return home to teach their neighbors. This multiplier effect from the income-generating projects is truly substantial. I would need to make mention of a nascent scholarship program where sponsors through the center have placed 2 youth leaders identified by Bahati through higher education in journalism and legal studies, 2 extremely crucial fields in any developing nation. Just one final note, Bahati has also recently established an alliance with partners in Uganda, Burundi, Congo, and Kenya to further the expansion of inclusive missions in Eastern Africa. These are exciting times indeed. You may have noticed on the financials chart Justin presented earlier that Rwanda accounts for only 5% of our grant distributions. But this can only grow, and I really hope it does. As the social return of our investments, there figures to be very, very positive. With this, I'd like to hand you over to Brad.
Hello, I'm Brad Bradford, Chin's partner, and as he just told you, we've been involved with the center since about 2017. I'm a retired Denver businessman, and I got involved with this, got to know Don through Chin that year when he invited us to go to Kenya. And Chin and I, who had been looking for something that we could do together and to make a contribution, um, found it to be really ideal. It's been for us um, one of the great joys in our life to be able to participate in the work that the center does. Don invited me to be on the board of directors, and I have been doing that since I think about the following year. And also starting the following year in 2018, Don invited Chin and I to go to India, and we've been doing that every year since, with the exception of 2 years during the pandemic. Um, Don's interest in India goes way back. Back to when he was in school there, and it's really a very interesting and inspiring history. And I'd like to ask him to tell you a little bit about that, after which I'll go ahead and tell you more about our current programs. Don?
Brad, everything about me goes way back to some ancient time. I see Roger Tanquist on here. His father was my first camp counselor in South Dakota in the early 1950s. So things really go back a long time. But in 19 in 63, 64, I went to India. I'll try to keep this story short here because I really do want to hear people's stories. While in India, I met a young man named N.M. Samuel, and he and I were volunteers on a leprosy clinic, which the college supported. Leprosy being the great scourge of that time in India and around the world. Uh, 35 years later, Bonnie and I returned to India, and to our great surprise, we were able to reconnect with N.M. Samuel, whom I'd had no contact with for 35 years. Uh, to my joy, he had indeed become a medical doctor, devoted his life to HIV, to leprosy, and with his wife, had been in Kenya, Bhutan, Nepal, and India. But Sam said, Don, I have now, as a medical doctor, focused on the new scourge of India, which was HIV and AIDS, but the church doesn't want anything to do with me. You know, before the church was empathetic and concerned for lepers, but HIV/AIDS scares people away because of human sexuality, unknown transmission, and so forth. So together, Sam and I decided to work on HIV and AIDS. So really, since at least 1995, the two of us have been engaged in these programs, which Brad will tell you more about. Dr. Sam unfortunately suffered a stroke a year ago and is unable to continue his active work, though his clinic is still active in Namako. Thank you.
Um, Dr. Sam's first program in India, um, which, by the way, is only one of several programs that the center supports, was the Women's Care Center in Namakkal. Namakkal is a city in southern India, which is at the intersection of a number of trucking routes. And there were primarily because of the men whose wives were at home and a large population of sex workers. It became a hotbed of HIV. And Sam set up a free clinic there called to take care of the women who were HIV positive and their children who were also HIV positive. And this care center, along with a kind of a satellite project in Coley Hills, a tribal area not too far away, Sam dedicated his life and did a great deal for this population in Namaqual. I think in the slide there you can see some of the work that's being done, food distribution, um, also medical services, and basically support of that community. Unfortunately, Dr. Sam has became ill this past year with a stroke and can no longer run the program. At the moment, the program is in transition and being overseen by the Tamaran Community Development Society, run by Pastor Donaraj, which is located in Chennai. And the center has supported him and the TCDS for many years now, but he is seeing the Namaqual project through a transition period. Um, he and Reverend Asir, who is head of the Indian National Council of Churches, are trying to evolve the program into a community resource center, which we are very interested in and enthusiastic about. The center feels that this will be uh, worthwhile new life for that program, and we're very interested in seeing how it progresses when we return next January. But right now, it's sort of it's kind of in betwixt and in between. Um, as I just mentioned, another big program of the centers in India is the Tamaran Community Development Center, run by Pastor Donaraj in Chennai. And Pastor Donaraj, for many years, has been a fierce advocate for the marginalized people in Chennai. And with the help of the center and some other nonprofits, he supports HIV positive women and orphans and children in Chennai, and he has a program that basically of nutritional supplement that the center has, which cares for a fairly substantial number of people, and as well as ancillary programs that the center has supported over the years. There's been there's been tutoring program over the year, as well as scholarships that have been granted to many of these people that Pastor Donaraj has taken into his care. Also, he has, with the center's help, um, started a number of income generating projects with these people for these people. And this has been particularly, although it's not on a large scale, has been very successful because it allows these women and also other groups to achieve self-sufficiency economically, which carries them on through their lives, helps their family, and contributes to community. Along with the HIV positive women, there's also a group of male sex workers whom in India are referred to as MSM, males having sex with men. These are men who are generally from very marginalized backgrounds. Often, some of them are gay, but often they're straight and have no choice but to go into to become sex workers in order to support themselves and their families. Um, Also in India, the center supports an orphanage in Kolkata, which has been a source of I think, great pride, even though it's not has not been the largest program for those of us who go to India every year. I know Chin and I, since we started going to India in 2018, have looked forward every year to seeing how these children are doing and how they are progressing. I think in the picture there, you can see you can see a number, you can see the children in the orphanage in the center, and on the left, there a number of them working at a computer. And one of the projects that the center has basically supported has been a computer lab. Also on the right, you have a young man there on the very far right, um, Mintu. We took note of Mintu clear back when he was just a child, who was basically the student leader, a very talented um, musician and a very bright and articulate young man. And he went on to get a scholarship from the center and then got a second scholarship to Dordt University in Iowa, where he is really where he has really been an outstanding success. He's a student leader. He is on the student orchestra and done a great deal as a member of that community. Um, so the Kolkata orphanage has been something that the center has given a great deal of support to. As I say, there's the computer labs and the computers. The center has also supported tutoring programs there, um, as well as helping with the remodeling of dormitories and various other projects at the orphanage. And this has been, as I have said, not one of the largest areas of support for the center, but something that has really been a bright spot. Also, I think I should point out that there are other programs in India aside for these three. Of particular interest, we have two programs that are just getting started um, this year. Both of them are in Chennai. One is a grief counseling program, and we have a donor here at the center who's very interested in this. And the center is starting a grief counseling program in Chennai, um, which we are very interested in. It's something new, and we were very interested in seeing what sort of success it has. Another program that we're quite interested in, and which we're going to be supporting this year, is a local trance center. The trance community in India is marginal, as you might expect, even though trans people in India have a certain kind of status in their own way. The community itself is very marginalized and stigmatized. And there's a center in Chennai that has done really quite a remarkable job of supporting these people there. And the center is going to support them starting this year. Also, I think I want to mention before I turn this back over to Justin, something that I think is very important, and has not it has the center has supported throughout India, in Calcutta and Chennai and in other cities, is HIV's education workshops. Every year, the center supports at least two and sometimes more HIV/AIDS education workshops. And these, I believe, are very powerful vehicles to train people about the problem, and the people who do get the training go on to train other people. So there's kind of a multiplier effect here. And I think this has been something the center has done that has been very worthwhile. Currently, the center's making plans for a trip for its annual a trip in again in January of 2026, which we're all looking forward to. And with that, I want to turn this back to Justin, who's going to talk about other center initiatives. Thank you very much.
Thank you, Brad. Well, it's really wonderful having everyone on the Zoom call. Thank you for taking the time. Um, if we haven't had a chance to meet in person or over the phone, I'm Justin Levy. I'm the new director. I started back in October. My background with the center goes back a few years. My wife and I have been donors and volunteers for about a decade. And in more recent years, traveled with the center in 2023 to Kenya and Rwanda. And after that, I had the pleasure of serving on the center's board. And next thing you know, we're looking for a director, and a few people nudged me to throw my hat in the ring, and here we are. And I'm truly honored to be in this role. So a little bit of you've seen over the last 40 minutes or so, the collaboration with the partners we have overseas and how important those collaborations are to our success. Certainly, a big part of my first few months on the job has been getting to know our partners even more, and slowly but surely exploring other ways we can help those impacted by HIV and AIDS. Um, I'm going to touch base real briefly on a couple of our partnerships here in the US, starting with the Tucson Interfaith HIV/AIDS Network. THON's been around for 30 years and has provided community resources and support for those living with HIV. And this partnership and collaboration really came from a handful of our donors who spend half the year in Tucson and half the year in the Denver metro area. And through those friends of the center, we have been collaborating with THON for about 10 years, raising money for both organizations. So annually, we have an event called the Red Concert. And this past March, we had our last joint fundraiser, which raised over $36,000, which was a record high. And those dollars are split between the two nonprofits. So THON's a wonderful partner. Another wonderful partner that's even closer to home is It Takes a Village, which is based here in Aurora. It Takes a Village is a free HIV clinic, and their mission is to reduce health and social disparities, especially among people of color. So their services include free HIV testing, connecting clients with prescriptions for PrEP, and I'm happy to share that their executive director, Mani Latif, recently joined our board of directors as we work to continue to provide support and compassion for those living with HIV. A couple of those partnerships in the U.S. mean a tremendous amount to us. We continue to make lots of outreach efforts to the greater community, whether it's congregations or service groups or individuals. We're working hard to bring more people under the tent and also figure out potential new partnerships here in Colorado and elsewhere. A couple of examples of some of these touch points in recent months. Back in February, we had a group of about 30 people who toured the Smithsonian's traveling exhibition on implicit bias at the Boulder Jewish Community Center. Just this past month in May, we had a social hour at a local LGBTQ plus friendly brewery to really engage and bring in new generations to support our work. So we had a really lovely group of folks in their 20s and 30s and 40s and of course older. So working on touch points with communities and organizations. And then at the end of this month, we will have a booth we're sharing with It Takes a Village at Denver's Pride Festival, which is one of the largest in the country. They expect about 500,000 people over the 2-day festival. So super excited for those touch points. And our next public event is actually coming up in August. For those of you who are in the Denver area, come join us for our 19th annual Swinging at AIDS golf tournament. And those dollars that are raised from the tournament go towards the programs that Brad just described in India. So I'm glad we'll have a few minutes here to chat and for you to answer some questions, but know how important your support is, especially in this day and age of federal cuts to programs like USAID and PEPFAR. It's going to be up to individuals like us and organizations like the center to help fill that enormous gap. So thank you for your continued support. And we'll now take any questions you might have about the programs described or future collaborations we're considering. Don't be bashful.
I
No
think one
questions.
problem is that everybody is muted.
Well, everyone can, of course, unmute.
Offer comments as well as questions.
I would just like to comment that I see Jonathan Hawkins on this event here today. Hi, Jonathan. And Jonathan worked with Dr. Samuel in India, right, Jonathan?
Yeah, that's correct, Bonnie. Actually, it was part of my graduate schooling. I did an international internship at the center in Namakal. So I lived there for 3 months, and it was an incredible cultural opportunity, personal growth and development. I actually did get to visit Coley Hills, and we participated in a health camp there. I am still actually in contact with some of the local staff that I had worked with. I don't know if you remember Stella. She's hard to forget if anybody has been there. Very loud personality. And still have some contact with VG as well. Yeah, I can tell you firsthand my experience. This is something that happened, 15 years ago, and I still think about it often. Want to be a part of this work and to continue to get future generations to participate as well. This is it's a program that has a lot of integrity and helps people directly and on the ground. It's something I'm really proud to have been a part of.
Thank you.
Well, this has been very enlightening for me. I really have been to a lot of things, particularly on Kenya, but I really had not understood the range of the work, and I really feel not well enough informed to make any suggestions. I mean, I would just say that it's really impressive. I do have one question for you,